Hello, everybody. Welcome as you are entering the studio to come hang out with me. I am so pleased to be here. I took last month off because of holidays and all that jazz, but I'm here back. And as you are all kind of trickling in, I will welcome you all as you come. And go ahead and tell me where you're from and what your cat's names are in the chat as we are starting to welcome all of our people. So, again, my name is Dr. Sarah Wooten. I am a veterinarian, a real live veterinarian, and I graduated from UC Davis in 2002, practiced in small animal medicine for 16 years, and now I do different things. I hang out, I do things like this, and it's great. I love it. So, this is an awesome hour where we actually get to just hang out together, and you get to ask me any questions that you want. So, I am going to be the way you ask your questions is you just stick them in the chat, and that way I can start scrolling through them and then I'll answer them as they come up. If you have a question, it's better to get it in earlier than later. What I have noticed with these is that the questions tend to pile up fairly quickly. And if you get here late to the party, then it's much harder for me to get to your question. So it just depends on how many people we end up having. But I always encourage people to get their questions in sooner rather than later. Okay. So when you're thinking about what kind of questions you want to ask, I encourage you to ask me medically related questions. You can ask me about behavior. I will tell you that I am not a feline behaviorist. I'm a veterinarian. And so most of my expertise comes from, you guessed it, practice and veterinary school. And while UC Davis has a great veterinary behavior program, it was not my emphasis while I was there. I did go rotate through it, but most of my expertise is in medical. Secondly, a little bit of housekeeping before we get in together. Hi, I see you guys all starting to show up. I'm Dr. Sarah Wooten. So glad to see you. If you have questions for me, just pop them in the chat and I will answer any questions that you have. Now, keep in mind that these answers that I am giving you are for educational purposes only and should not substitute for the advice of your local veterinarian. I am not here actually giving you advice. This is just for educational purposes. I'm going to be talking to you like a friend who phoned me up and said, "Hey," and I don't actually see their pet. "Hey, Dr. Sarah, I'm having this problem. What do you think?" And I'll tell you exactly what I think. But remember, just should never substitute for the advice for your local veterinarian. I have my little Post-it over here of all my housekeeping things. Secondly, last time we did this, I actually went through the questions at the end and kind of looked because there was so many I didn't get to. And I saw that there was a little controversy brewing in the chat section that this session wasn't live and that it was actually pre-recorded and that I actually wouldn't be answering your questions. That, my friends, is false. Yes, so you see Restream right up there, right? Some people were like, "Oh, this is restreamed. She's not actually here. Oh, I'm so angry." Well, it turns out we just use the Restream platform because it helps us to reach so many different platforms at the same time. I am in actuality here live, and to prove it to you, here's my phone. Oop, can you see it? I don't even know if you can see that. Can you see that? Oh, shoot, it's very bright. There you go. You see? It said 2 o'clock. I am in Mountain Standard Time right now. So it is 2 o'clock for me here. I don't know where you guys are. I know that you tune in from all over the world, but I am live and I will answer your questions. So get them into the chat section as fast as you can, because again, they do pile up really quickly and I have a hard time getting to all of them before the end of the session. I've already told you, I think, all of my housekeeping stuff I want to go through. And before I start getting to your questions, I did get a letter from a viewer who, from Yesim Kartali. Yesim Kartali. I apologize if I am butchering your name, but it said, "I follow Dr. Sarah in YouTube and I enjoy your videos." Yay, thank you. I'm an expat in Kuwait. I live with 2 cats who I found abandoned 2 years ago. I would like Dr. Doctor video. Dr. Sarah to shoot a video on traveling with cats to a vet check, how to handle the road car stress. It would be very helpful. Great question. Okay, so I'm going to address that and then I'm going to get to your questions that you have in the chat session. So, the most important thing to do, yes, and all of you people who are wondering about how to travel with a cat without, you know, all the stress that's associated usually, is these cats need to be conditioned to be able to accept riding in a crate. So that requires practice, right? That requires starting way ahead of time to get that cat used to it. So say you have a vet check or something in 2 months, right? 2 months seems like a really nice length of time in order to practice with a cat. So you want to get your crate, and the first thing you want to do is you want to leave it open around your house and let the cat do whatever they want with it, right? Let them sleep in it, put some, toys in there. You can put some treats in there. You put some bedding in there. You can even put food in there and just leave the door open and let the cat start to get used to it, right? Maybe they'll choose to go in there and sleep or play or do fun things. But the thing is, you have to build in your cat's mind a positive association between the experience of the crate, being in the crate as a thing, and good stuff like treats or bedding or nice petting or whatever. So just leave the crate open around your house. I would do that for probably at least a week. And hope if your cat's not using it, you can try and put the treats in there, put some food in there, whatever you can. Don't shut the door. Just let them get used to it. Then once you notice that the cat is used to and comfortable with the crate, then you can practice with shutting the door for short periods of time. Again, I would make sure to have something in that crate that the cat likes, like some treats or catnip or whatever you want. And then just shut the door for short periods of time. As long as your cat doesn't, have dilated eyes or start meowing or look nervous in any way, then you can proceed to the next step. So I would, shut the door for short periods of time for maybe a day or two. Then the next thing is just shutting the door, picking the cat up in the crate, and then setting it back down. And then you do this a couple of times, couple of days, right? That gets the cat comfortable. Oh, I get in here, I eat some treats, I go up high, I come back down low, nothing happens, right? Then the next thing is to pick it up and walk around with it a little bit. And then the next thing to do after that is to put it in the car. So most people's car seats are tilted for our comfort, right? Your legs are tilted when you're sitting. But what that does is it takes the crate and it tilts it. And then the cat's sitting like sideways. And that's very stressful. So take a towel and prop it so that the level of the crate is very level and there is no tilting. Again, remember to use your treats, lots of positive praise, go slow. Put it in the car, shut the door. Don't drive anywhere. Try that a couple of times. The next time, take them for a ride around the block. Okay. What you're going to want to do is you're going to want to make these trips longer and longer and longer. And you don't want it just every time the cat gets in the crate, they go to the scary vet hospital. You don't want that, right? You want them to go, oh, I get in the crate, I drive around, I ride around, nothing happens except for good things, treats. Great, right? Then once that's going well, you can start to extend those trips longer and longer and longer. Okay. Then the other thing is to make sure that it would be helpful if you utilized a veterinary clinic, if you are going for vet visits, that utilize low stress handling techniques or fear-free techniques. Fear-free is basically a movement within the veterinary industry, within my industry, where we have come to understand that the stress associated with taking an animal to a veterinary hospital can be high enough that people don't want to come back, right? Because it's a terrible experience. And then the animals don't get the care that they need, or it causes the animal to have more problems because they're just so stressed. So look for a clinic that is fear-free certified or utilizes fear-free techniques. And you can ask them when you call them as well. Or they utilize low stress handling techniques. Or Just ask them, you know, how do you handle these animals and how do you keep their stress levels down? Okay. And then if you want to learn more about this, you can do one of two things. You can visit the Fear Free website. I think it's Fear Free Happy Homes or Fear Free Pets. Fear Free. Just Google Fear Free, it'll come up. Or you can Google Sophia Yen. Sophia Yen. She is the pioneer of low stress handling techniques in animals, and you can learn all sorts of ways to make these trips go better. Lastly, if your animal experiences a lot of anxiety when they're in the crate and you're just like, I don't know what to do, there are extra calming aids that you can use. Calming aids aid in helping your pet be calm, right? So, one of the things is just maybe there's a product called a Thunder Shirt. It's kind of like a weighted blanket, but for a pet, you put it on really tight and it's supposed to have a calming effect. That works for some cats. Other cats benefit from Feel Away, which is a pheromone spray. Again, some cats, this makes them more hyper. Other cats, it makes them super chill. Most of the time when we use Feel Away, when I was in practice, it would make the cats super chill. They start purring and making their biscuits and all of that stuff. So Feel Away is a great product. You can spray it on the carrier. Other options, there are other over-the-counter calming aids. One of the ones I like a lot is Anxitane. Anxitane, Anxitane by Verbac. It just is L-theanine and it works as a great calming supplement for mild cases. Another one that's good for mild anxiety and just calming is Zylkene, Zylkene. You can get those both over the counter without any prescription required. Some cats benefit from CBD oil, so it could be worth a try. There are other options as well. As far as the more severe cases go, if you're just like, nope, none of this is working, I need help, then talk to your veterinarian about prescription strength anti-anxiety medication. The two ones that we tend to use in cats a lot, gabapentin, which is a muscle relaxant, very safe. Cats love it. It makes them feel so good. Gabapentin's one. Trazodone is another one that we often prescribe. Some cats can benefit from diazepam, right? A benzodiazepam. It's Xanax. But if you're going to talk to your veterinarian about diazepam usage in your cat, I would recommend having blood work run first, because some cats can have an adverse reaction to diazepam that is related to the liver. Okay, so the other two, gabapentin, trazodone, tend to be very safe. And don't hesitate to ask your vet about those. The thing about any of these calming aids is you have to get them on board before you do anything stressful. So you need to get them, and you need to make sure that your cat's going to do okay with them. So whenever somebody was asking me for these calming aids or prescription, I said, okay, here's your prescription. I need you to practice with this with your cat. So give a dose at home before you go anywhere. Don't even go anywhere that day, and see how your cat does. Because sometimes some cats can have weird reactions. It can make them more excitable or just too sedate. So you really want to practice. You want to make sure to have everything on board before you do anything stressful. And that includes, for some cats, even getting the crate out. I've seen cats where you get a crate out, they look at it, and then they take off, right? So you want to make sure to institute any calming aids before you do anything stressful. Okay, so now that I have said that, I'm going to start looking at your comments, okay? So, hi, Cat Meow Aloud. You're from California, and your cat's name Tamale. We have somebody from Dubai whose cat's name is Hoyam. Hi, Cyber Ghouls. Hi, Hoani. Am I saying your name right? In Sydney, with your cats Drew and Ollie. All right. Hi, everybody. Okay, here we go. We're going to dive right in. What are my thoughts on coconut oil for cleaning ears and avoiding ear mites? It doesn't work at all. So I have seen so many wonderful, well-meaning pet parents who have done something for their pet's skin on some level with coconut oil. And I would say, you know, it's always worth a try, but it 99 out of 999% times doesn't work. Wah, wah. I had this one poor lady come in with their dog one time. No names, no shame. Dog had no hair, totally red, totally itchy. And she was like, I've been putting coconut oil all over this dog for 3 weeks and all his hair fell out because he had a bacterial infection. And I was like, well, that's not working. So let's try something different. So I don't find success with using coconut oil for ear mites. The only thing I find use for getting rid of ear mites are anti-parasitic medications that go right in the ears. So there's several different ones out there. Talk to your vet. Ear mites, the good news is, even though they're super contagious, very easy to treat. Very, very easy to treat. Unless your cat's getting reinfested from somewhere, in which case you're going to have to look and see where your cat's going and who your cat's hanging out with, because it can transfer from cat to cat to cat. Even after you've treated your cat, they can get infested again if they're hanging out with another cat that has ear mites. And you do have to treat all the cats in the household at the same time. Okay, quick question from Sarah Corona. Hi, my friend. You do not have a good last name. I'm just joking with you. Okay. How much wet food should I feed my kitten who's 4 months old? Great question. So first of all, make sure you are feeding high quality kitten food. And as far as canned food goes, I always like, if you are feeding conventional foods to your cat, which is totally fine. By the way, I'm a fan of different kinds of diets as long as they are complete and balanced. That's very important to me. But as far as feeding your kitten, and as far as how much to do for dry and how much to do for wet, I would say if you do 75% of the food as dry and then 25% of the food as canned, then your cat should get the moisture and the protein and all the benefits. Even if you want to do 50-50, that's totally fine as well. How much to feed of both of those, past the percentage, depends on how many calories are in the food. So one of the big problems, no pun intended, with our domestic cats is obesity. Most of these cats, especially here in the US, are too fat. In fact, there are so many fat cats in the US, people have forgotten what a thin, normal body condition cat looks like. And I'll tell them, your cat looks great. And they're like, oh my God, it's too thin. No, it's just that too many of the cats are too heavy. So your cat is growing quickly, right? So you are going to, what I would recommend is weigh your cat and look on the back of the bag and then look at what they're telling you to feed and use that as your guidelines. You want a kitten that is thin, not skinny, not fat. The best way to determine your cat's body condition is to feel their ribs. Their ribs are located right behind their front legs, right? Right in the middle of their body, right behind their front legs. If you go like this, you'll feel ribs. And so if the ribs feel like the back of the hand right here, perfect. That's exactly how your cat's ribs are supposed to feel, just like this. If you feel for ribs and you can't find them, or they feel fluffy, like the palm of your hand, too fat. If the ribs are sticking out, and get my angle correctly, right? Or they feel like the knuckles too thin. Okay, so adjust your feeding based on what you feel. And then you can do 50-50 on canned, dry. You can do 75 dry, 25 canned. I just wouldn't go more than 50% of the diet is canned, but that's just me. Okay, and again, not for medical advice, for educational purposes only. All right, Amelia Madrigal. Are you from the family Madrigal, right? From Encanto? Okay. What are the best feeders for a fat cat? Ooh. Okay, so My recommendations are a automatic feeder that you can program to dispense smaller amounts of food multiple times a day. That's an easy way to do it. The other way is these things called no bowl feeders. Oh, they're so amazing. Look into them. There's some really good products out there. I actually love these little ones that have the mice that you can stuff food into. And then you can hide the mice around so the cat has to hunt. The most important thing is for fat cats, remember that kibble, the conventional kibbles that are out there, they tend to be very calorie dense. And you have to feed them such small amounts that sometimes these cats eat through their food so fast that they're looking around for more, right? So not only getting them a feeder that dispenses small amounts of food multiple times a day, but doesn't go over the certain amount that you have set for the day, but also feeding something that is less calorically dense. Your weight management foods, your light, I don't know about the light foods, but the weight loss foods, those are important because the cat can eat a little bit more, feel a little bit fuller, and not have as much calories. So those are a couple of recommendations. Also, you can take the kibble as well. This is a great way to play with your cat and get them to exercise and get some mental stimulation and allow them to hunt. And take the kibble that you've measured out for the day and then just toss them one kibble at a time. Toss it. Let your cat hunt and pounce on the kibble. It's a way to get extra exercise. They get to engage in their hunting instinct, which is very important for their mental well-being. You get to play with them a little bit and you get to control their calories. Okay. So, okay, you guys are so silly. Dustin, I have a question. Is Mallory single? My friend, I don't even know, but I'll have to ask her and I'll have to tell you that you asked about her. Mallory is one of the people who works on this channel for me. So, okay. Why does my cat's coat get greasy easily, even when I brush his coat every day? Well, your cat could have a condition where they have seborrhea. Seborrhea is excessive scaling and it's excessive dandruff, basically. And so if that's an issue with your cat, it could be an environment, it could be a problem just with your cat. And so there are lots of different, I'm just looking in my dermatology book for you guys right now, really quick. There are several different types of seborrheic diseases in cats, and they often can require a medicated shampoo to kind of break up that grease and lift it up out of your cat's coat. So I would say talk to your veterinarian about the grease in your cat's coat and see if you need to get a medicated shampoo for your cat. And then bathing your cat is an entirely different topic, so hopefully nobody will ask me about that. But it could also be sometimes cats can have internal disorders that can manifest in the hair coat quality. And if cats aren't grooming enough for any particular reason, even if you are brushing them, that can also result in greasy hair coats. And so if a cat's not grooming enough, why? Why is that cat not grooming enough? Do they not feel good? Do they have a mental issue? Is there something else going on that we need to know about? Right? So I would say if you're concerned, have a vet check your cat out because sometimes there's something easy that you're not seeing that the veterinarian can easily see and remedy for it. But if you're not noticing any improvement in the greasiness, even with brushing every day, which good job, then you need to get somebody else's professional opinion. Sorry, I was reading another question. All right, Miss Cat, hello. Why does my cat's ear tips suddenly get floppy? Well, I am not sure. That is an interesting question. So are you talking about just the ears, like are they putting the ears down? Or like have the ears just gone roar? right? So there are certain breeds like the Scottish Fold that do have naturally floppy ears that are kind of folded forward. But if your cat is holding their ears down a lot, that indicates that there could be an issue with the ears themselves, or there could be something in the cat's behavior. So I'll need you to give me a little bit more details on that one before I can give you any kind of my thoughts on it. Okay. So, Cyber Rules. Hello, my friend. So, I started adding water to my cat's wet food. Good for you. Why does he like drinking the water in his bowl instead of eating it? They have a running water fountain away from their food bowl. I have no idea. I don't know. Cats are going to be cats. Maybe it just tastes really good. Maybe it's just an enjoyable experience for your cat to be able to drink flavored water, basically. So, the one thing I wouldn't do is worry about it because it's actually a really good thing that your cat is getting all that additional moisture. So, and even if I saw you in a veterinary hospital, I would tell you the same thing. Okay. Okay, here we go. Susan Hoover, my friend, hello. Thank you for your question. Recently, my cat started drinking a lot more water than usual. He even woke me up last night, lapping water from the dish in my bedroom. What would be making him urinate more frequently? Great question. So there's several conditions in cats that can cause them to pee more and drink more. So our official doctory term for that is polyuria, which is peeing more, and polydipsia, which is drinking more. The most common cause for that in cats is issues with the kidneys. If the kidneys are not filtering and doing their job the way they need to, which is part of that is conserving water, then that can lead a cat to drink more or pee more. Another common reason that cats will pee more and drink more is diabetes. Normally, the most common type of diabetes in cats is type 2 diabetes, and that is the type of diabetes where they have insulin resistance, and that occurs secondary to obesity. So, cats that are too big, they lose sensitivity to their insulin, and insulin is what moves the blood, the sugar from the blood into the organs, right? And back again, back and forth. And so what happens is all that increased sugar flowing around the system causes them to drink more. Hyperthyroidism is another common cause. So, hyperthyroidism is when the thyroid gland in the neck develops a tumor, and then it causes them to secrete too much thyroid hormone. And then they have a lot of different signs drinking more, peeing more, they lose weight, they eat more, they tend to be up and they're yowling and hyperactive. Their hair coat starts to get a little weird. It's a problem in older cats. Bottom line, Miss Susan, you need to see your vet. And your vet needs to run some blood work and a urinalysis and see if they can't determine what the cause is. It's usually very simple for veterinarians to figure it out. Ooh, okay. Behavior question. I will do my best. So, to, so, toe. My Bengal boy has become finicky. How can I get him to eat without me having to spoon feed him? Okay, well, there's a lot of different factors that could be at work here. I don't know how old your cat is or if your cat's acting normally otherwise, because again, there's lots of different diseases that can cause an animal to go off their feed and then they become more finicky. Now, the fact that you say that you have a Bengal, there could be a behavioral component there. I don't know, might, maybe. But once your cat is accustomed to you, has trained you to do that, then it's a little bit harder to get them to stop doing that. So, couple of ideas could be that your cat isn't liking the food that you are feeding. And so you have to be able to, and these are behavioral ideas. So maybe switching the diet might be in order. Maybe getting some rotisserie chicken, like just a baked chicken breast, and shredding some chicken and sticking it on top of the food when it's warm is often a good way to get cats to be able to eat, right? But I think it's really important that you make sure that there's nothing going on wrong because cats, when they stop eating or they start hiding or they start urinating or defecating anywhere in the house other than their litter box, they're not being jerks. They're trying to tell us something. So there's something potentially going on in your cat's environment that has caused them to go off their feed. And it's either medical or it's behavioral, right? So you need to do a little detective work, and you probably need to work with a local veterinarian just to ensure that the cat is totally healthy and you're not missing anything before you start to go on the behavioral train. Okay? Hopefully that helps you a little bit. Johnny angels are real. Sending love and light your way. I will receive that. Thank you so very much. Okay. Marcy, hello, leopard lady. What's your best advice on shedding? My cat sheds a lot. Oh my. Okay, so first of all, make sure that we're dealing with shedding and not hair loss. So shedding is when the cats lose a lot of hair, but then they still have a lot of hair. If your cat is losing a lot of hair and has bald spots, go to your vet. If your cat is losing a lot of hair, but still has a nice full hair coat, couple of things. So get a deferminator brush or a knockoff of that particular brand. It's like a rake. And what that does is when you rake the cat, and then I would use it several times a week. When you rake the cat, it tends to take any of the fur that's loose but hasn't fallen out, and it removes it. And then I would go both ways. I would rake one way and then I would rake the other way. That would be an excellent way. Some people do find a benefit from so-called de-shedding shampoos. I don't know if those work or not. I don't know if it's just a marketing thing or if they're actually working. So look into a de-shedding shampoo, but I really do recommend one of those rakes. Those really help a lot. Conversely, you can always have your cat shaved. A lion cut on a cat can look pretty silly, but that can eliminate the problem as well. Okay, so see if those don't help you a little bit. Okay, this is a great question that I don't necessarily have an answer to right now, because honestly, I have not. Cistinuria. So thank you, Mesmerize. Have you encountered a cat with cistinuria? So are you talking about a particular type of bladder crystal, like cystine crystals? None of the vets I've talked to have, and my cat has it. I'm interested in how you treat it in a cat. Any medications with arginine? What? Food? Great questions. I cannot answer those questions without doing an in-depth medical investigation, because this is a very rare condition. And personally, I have never encountered a cat with, I think you're talking about cystine crystals. Your best bet, my friend, is to query a local veterinary hospital or query a local specialty hospital that has veterinary board certified internal medicine specialists. And then I would either, what I would probably do if I were in your shoes is I would query them and set up a phone consult or a Zoom consult with them, because I guarantee you they see all the weird stuff, the stuff that we call zebras that you don't ever see in general medicine. We have a saying in veterinary medicine: when you hear hoofbeats, think horses, not zebras. So when it comes to bladder crystals and stones, the most common ones we see are calcium oxalate and struvite. I've never seen cystine. So I would set up a consult with a board certified internal medicine specialist. You're going to pay for it, right? But they are going to know exactly what the condition is, what it causes, medications and food, and follow up, right? All those things. So that's who you need to talk to. Board certified internal medicine specialist. Okay, good questions. Oh, all right, Leona. My friend, first of all, do not beat yourself. Is there anything known of what causes kidney disease? I currently have 4 cats with kidney disease and can't help but blame myself for something I'm doing wrong. Okay, don't. All right. First of all, no self blame, not helpful. Don't do that. So, yeah, we know a lot of things that can cause kidney disease. So, for example, in smushed face cats, Persians, they have the smush face, and some of the Asian breeds as well. Certain lines of cats can have cysts in their kidneys, which cause them to have kidney disease sooner. So, that is a known cause. Another cause is prolonged inflammation or damage due to kidney infections, cancer, stones, things like that. Another cause, not so much a cause, but another co-founding comorbidity, co-sickness that we see with kidney disease is hyperthyroidism. And I love that you're asking this question because I feel like more people need to ask the question. When I was in practice, I was always asking the question, what causes this? Yes, I know I have a pill or a surgery that can fix it, but what is causing it? And so I still don't think even the leading researchers in kidney disease have drilled down as to why these domestic cats, after a certain age, tend to have decreased kidney um, capabilities. But I feel like that's where we need to go. Is it genetic? Is it environmental? Right? Some people were speculating on the lining of cat food cans for a while as a cause of, kind of some of these chronic diseases in cats. I don't know what happened with that, but right, there's got to be something. So as long as you are feeding your cats high quality food, getting them the exercise and stimulation, making sure that they are using their litter boxes on a regular basis, getting them, checked up by a veterinarian on a regular basis, you're doing everything you can. Okay. So I don't have the answer to that question. In fact, what I could do, I can consult. I have my 5-minute veterinary consult up here. Actually, no, I'm not. I'm not going to do that right now because I'm gonna move on. So, good question. Do not blame yourself. Do not. Okay, here's another question about feeding. Brianna, the Brianna-nator. My 4-year-old domestic long hair is so picky, cannot get her to eat any consistent food brand. And she doesn't free feed help. Well, again, it's important to make sure that there isn't any kind of underlying issues that are causing her to be picky, right? Also, to have her checked and make sure she's at an appropriate weight because again, we're so used to seeing cats that are really heavy. Sometimes we're actually surprised at how little these animals will eat and what their actual weight should be. So if she's picky, but she still has a good body condition, like I talked about, like if her bones aren't sticking out and you can feel her ribs and they feel like the back of your hand, then she's probably consuming enough. If she's underweight, right, and her ribs are sticking out like your knuckles, then there's something going on, right? And it could just be behavioral, but she could have dental disease that you don't know about. There is actually a high percentage of cats out there over like age 4 that have undiagnosed dental disease, especially these things called FORLs. They're feline odontic resorptive lesions, and they're like cavities in humans, but they're not caused by sugar. They are caused, they have lots of different causes, but they're very, very painful, right? And so it could be that your cat has dental disease. Could be that your cat is sensitive to certain ingredients and gets nauseous after they eat, and so doesn't want to eat anymore because that's associated with a bad feeling. Could be that they've been traumatized by whatever and associate that with eating, right? And then they don't want to eat. Could be attention seeking behavior, right? So the first thing, again, I'm going to go back is make sure that that cat is healthy. Make sure there's nothing going on under the hood per se that could lead to a picky appetite. Because in my experience, like 8 times out of 10, there's something going on that people just didn't even know about, right? So, could be parasites. I don't know, right? Okay. This is this is such a great question. I mean, my cat runs out of the room when Wheel of Fortune comes on. Hold on. That is awesome, okay? With the sound on or off, it doesn't matter. The show has lots of bright colors. Could that disturb the cat's eyes? Yeah, it actually could, right? We don't know what the world looks like through these cat's eyes. I don't know if you've seen any of the shows that are coming out these days in Technicolor. Hello, Squid Games. Terrifying, right? And it could be like that bright flashing is something that is disturbing your cat. Maybe, no, I'm not going to speculate anymore, but I love this question and I had to put it up. So, my recommendation to you, no more Wheel of Fortune. Don't do it. Okay. Great question. Jarhead, my friend, hello. I think you've been here before. Is it necessary to trim a cat's hind leg claws? I've only been clipping his front. No, not necessarily. You don't have to. If your cat's back nails are nice and healthy and not too long and not scratching you or anything in your house, leave them be, right? And just trim the front. But you can trim the back claws as well. Whenever you take your cat in for professional nail trimming, they will trim the front and back claws. Okay, here is a question from Gum. Hello, my friend. My cat has a lot of black spots on her chin. I've seen that is apparently acne. What can I do to stop it? Great questions. Okay. Numero uno. Make sure you're feeding your cat out of a stainless steel bowl. You don't want to use plastic. I don't like ceramic because it has these like microscopic pores that can harbor bacteria that jump onto the cat's face and then cause chin acne. Okay. So stainless steel, and then wash it a couple of times a week, right? So there's no bacterial buildup. Secondly, either get some medicated pads from your veterinarian that have an antibacterial component in them, or head on down to your Walgreens and get your over-the-counter acne pads for humans, Stridex, whatever, generic, I don't care, and use those and then wipe your cat's chin twice a day until it's gone. Okay? If that does not help, then it could be that your cat has an ingredient sensitivity and you'll need to talk to your veterinarian about getting your cat on either a hypoallergenic or a novel protein diet to run a food trial. Okay. But try those first two things first. And 9 times out of 10, that clears it up. Okay. Ta-da. How do I make my 2 adopted cats like each other? One is 15 and refuses to warm up to the other who is 7. Well, sometimes we cannot force it with cats. So the most important thing is to not force it because you cannot force cats to like each other. If your older cat is just not having it, then your older cat needs to have places where that they can retreat to and not be bothered by the younger cat. Just like humans, some cats are introverts, some cats are extroverts, some cats are ambiverts, some cats' personalities change based on the situation. So it's really important to make sure both cats have their own set of resources that are separate from each other. When I say resources, I mean things like bedding, food and water bowls, cat toys, cat trees, scratching stuff, hiding, resting places, and litter boxes. It's also important to have enough litter boxes for the number of cats that you have. Experts recommend having 1 more box than number of cats, so that would be 3 boxes. Okay, so couple of things you could try. If your younger cat is like very rambunctious and wants to play, increase your play sessions with the younger cat so they are more tired. You can try putting treats together in the same area and letting them, eat the treats and be kind of, around each other, but not interacting. You can try applying feel away to the places you want them to hang out together. That's the pheromone spray I was talking about earlier. Feel away. It makes cats feel happy. But again, if the older cat is just not having it, that's okay. That's okay, right? Make sure they have space away from each other, their own resources. Try those couple of things. And also, you can consult with your local veterinarian and see if there is anything else that you can do. Okay. Okay, here we go. How to get my 10-year-old cat that I just got 6 months ago to lose weight. He eats all of the other cat's food. He weighs almost 16 pounds. Oh my God. Okay, so a couple of things. You got 3 cats and you got 1 fat cat. So what I would recommend doing is you can buy one of those feeders that is only cued to specific tags. So you put a tag on your cat's collar. Then when they walk up to the feeder will open to them if they have that collar. It's very cool technological gadgetry. That's one way to do it. One of the easier, more ingenious ways I've seen people do it is they get a big plastic tub and then they cut a hole in the side that is only big enough for the skinny cats to fit through. And then they put the skinny cat's food in there. And then they put the fat cat food out. So when the fat cat's done eating, it can't get into the skinny cat place. So those are 2 things that you can try. Good luck, my friend. Good job noticing that it's an issue. 16 pounds. Oof. That's pretty big. Okay, Susan, I answered your question about the drinking a lot. Here's a quick question about, why isn't it showing? Oh, there it is. And I wonder how often we should clip a cat's claws. I would say you can, if you are normally, if you're doing it regularly, you can clip once a week, right? Every 2 weeks. But if they're scratching a lot and you don't have to clip very often, once a month. But some people find it more beneficial to clip more often because the cat gets used to it. So, okay, there you go. Okay, here's a good one. This is a good question. Merzbo, why does my cat take a dump and then immediately run down the hallway as fast as possible? That's because either the process of taking a dump itself hurts for some reason, or your cat has experienced some sort of traumatic event with that litter box and so has to just get away from it as soon as possible. So I'm not sure why it could hurt. Lots of reasons: constipation, anal gland issues, a dermatitis around the anus, diarrhea, lots of different things, right? So I would, again, make sure that your cat's all physically normal back there. And then also, kind of watch your cat, make sure there's no other cats bullying them. Maybe they don't like the location of where the litter box is. I've seen cats who get terrified by a laundry machine or a furnace that's right by their litter box, and then they become terrified of their litter box. So a couple of different ideas from you. Thank you for the question. Hi, Kathy. Hi, Dr. Sarah. I will be getting cats, preferably 2 from the same litter next year. What are the chances they won't get along as they grow older, and what can I do to prevent that from happening? Well, hopefully you just heard the little bit that I was talking to the other person who had the 2 cats, 15-year-old and 7-year-old cat. So there's a pretty good chance that those cats that you are adopting from the same litter are going to get along just great, because cats form very tight, very cliquish social groups. They are not inclusive. They are not about diversity. They can even have a social group with just one, right? And they form these social groups and then nobody else is allowed in, right? But if they're from the same litter and they have already been hanging out, chances are very, very high that they are going to get along well, because they're coming from the same social group and they're going to form the same social group in your house at the same time. That's why it's often harder to introduce new cats into already established social groups. Some things that you can do, kind of what I was saying to the other person, is make sure each cat has their own set of resources: bedding, food, water bowls, litter boxes, cat toys, scratching, places to hide and rest that they can get along, they can be by themselves. Okay. By doing that, and making sure that there's no competition between these resources and making sure that their interactions are positive, there's a really good likelihood that they're going to get along just fine. Okay, Katie, my friend, hello. My cat was diagnosed with small kidneys when she was 2. She had an x-ray for an unrelated reason. We feed her special food now. Will the condition shorten her life? Good question. It depends on if her kidney function is reduced. So if her kidneys cannot function well enough to support life, then it can. But if there's no changes in her blood work, then her size of her kidneys should not matter at all, right? I've seen cats with small kidneys that have totally normal blood work and live totally normal lives. So the best thing you can do is get her kidney values checked once a year. That'll let you know if there's any changes in kidney function. Also, if there are no changes in kidney function, you may not need to be feeding like a protein restricted diet. Again, this is for educational purposes only. But one thing I've found with veterinarians, including myself, is that we were taught as soon as we were suspicious of any kind of kidney problems to restrict the protein. And now we're finding that we don't necessarily need to do that if the cat's kidney functions are normal. So if your cat's doing really well blood work wise, yeah, talk to your veterinarian about. Oftentimes I would just put them on a high quality senior diet because those are high in antioxidants, which help protect kidneys. But yeah, that's kind of what I have to say from that. Okay. To get away from this, I see you guys making jokes in the chat. Okay. Wait. Oh, great question. Ways to provide more stimulation for my cat without breaking the bank. Thank you, Selena, for giving me this question. So I don't know if you know this, but feline environmental enrichment is a big, big area of interest because we're finding that these indoor cats, even though they live longer because they're not getting hunted or hit by cars or bit by dogs, they are having problems with being bored, right? So, a couple of things that you can do. You can make homemade cat toys. Go on YouTube, just type in homemade cat toys. You will come up with so many videos on so many cool ideas. One of my favorites is you take an egg carton, you flip it upside down so all the bumps are sticking up, and then you kind of just sprinkle kibble in between in those little like crevices and set it down, and then let your cat try to get that out of there. Another thing that cats love is those the paper towel tubes, right? Those make for really great cat toys. You can like glue or tape a bunch of them together, and then you can hide food in them and have the cats try to like get it out, right? They try and get it with their paws. Or you can put some kibble in there and tie the edges or like twist the edges and then, throw it, and it's a little rattler that smells like food. Cats love that as well. So go on YouTube, Google homemade cat toys. So many great ideas. Lots of great ways to do it without having to spend an arm and a leg. Okay. Thank you, Crazy NZ, for the good vibes. I love that. Okay. And again, I see you guys interacting in the chat. Anytime a cat runs out of a litter box after doing their business, that means that something has either hurt them or scared them. So you need to find out which it is and then correct it, okay? And if it's hurting them, then you need to talk to a veterinarian. And yeah, I get it. We're kind of a pain in the ass right now. Okay. Oh, this is okay. I'll try to answer this. Okay, lovely me, Jenny. Yes, you are. Recently saw there is vegan cat food and read that studies show that cats can be very healthy without meat in their diet. What is your opinion on that? My opinion on this is that cats are obligate carnivores in the wild. So if you go back to cats' ancestors, they ate they were predators, right? And they did eat the whole prey, right? And that included whatever was in their stomach, which was roughage, right? Plant material. However, cats do require protein, animal protein for energy, where animals such as us and dogs, we get our energy from carbohydrates and fats. Cats require protein for their energy. The other thing is if a cat's gut is a very different, like their intestines, they're very different. They're very different than a human intestine or a dog intestine. And they are designed to process meat. So my opinion is we got to feed the cats meat. But that's just my opinion. There's lots of opinions out there. Dogs, on the other hand, have co-evolved along humans for thousands and thousands and thousands of years, and their guts evolved thousands of years ago to be able to digest cereal grains that were thrown from the caveman to the dog, and they actually learned to subsist on this kind of stuff. So all of the advertising about dogs being carnivores, not so much. Cats are carnivores. So, but that's just my opinion. Okay, I am not going to answer any questions about specific cat brand recommendations because I don't want to make anybody mad at me. Okay. Hi, Robin. I will do my best. My 3-year-old male keeps chasing and pouncing on my 12-year-old female. I'm sure she does not like that, right? Is there any way to stop this? So sounds like your 3-year-old needs more exercise and more mental stimulation. So the first thing I would do is I would step up your play sessions per day. I would add another hour. I know that sounds like a lot. And if you can't do that much, I would start with at least try 30 minutes in the morning and 30 minutes at night. The other thing is to make sure that your female cat has a place where she can get away, where the other cat can't go. Sometimes this requires a little ingenuity or some technology. But the first thing I would do is I would really step up those play sessions a lot, right? And if you can do even more, that would be preferable. Make sure the older female cat has a place to get away to. And then I would not do any kind of punishment for it because all that's going to do really is it's going to create conflict in your relationship with your younger cat. Your older female cat, if it's enough is enough, she'll probably speak up for herself, but try increasing those play sessions to start. Okay. Okay. Here in Grants Pass, Oregon, no vets are taking new patients. Is this everywhere? I don't know. I honestly don't know. And frankly, I'm a little disappointed in my profession right now because our first thing that we are supposed to do is, above all, do no harm. And the fact that we're so concerned about our safety, we are leaving potentially millions of animals without care because you all got pets during whatever lockdowns and stuff. And now we're not here to help you. So I have heard this over and over and over from different places. You are not alone. And I would, you know what I would do? I would take this to the media. I would write your local paper. I would write the AVMA. I would write your local VMA. So each state has their own veterinary medical associations. And I would tell them exactly how much this is impacting animal health. Because again, we took an oath, above all, do no harm, right? And by our current way of acting with the public, I feel like we are doing harm, right? But it's going to take consumers and pet parents like you guys speaking out in order, I think, for something to change, right? Unless there are some other big things that happen within our profession, which this is neither the time nor the space, but I am sorry if you are having a hard time getting in to see a veterinarian. I feel like we're failing you a little bit, and I would be happy to say that on record, right? So yeah, you are not alone in feeling that. Okay. So on that note, my friends, I see there are literally hundreds of questions that I have not got to. So I apologize because I want to be able to get these questions for you. But it has been an hour. How did that happen so fast? So if you did not have your question answered today, I highly encourage you to head on over to the All About Cats community. There are forums there where you can ask your question. And what I've noticed is there's actually veterinarians and experts hanging out on those forums who can actually answer your questions. So if you didn't get an answer today, head on over there for more expert advice. And for all of you that came and hung out with me for this hour, I am so grateful for you. I hope that you are well and that you are healthy and that this information has been helpful to you. And I will be back. I plan to be back the last Tuesday of every month at my time, 2 p.m. Mountain Standard Time. And if you want your questions answered, I always recommend jump on as soon as it starts and type your question in at the very beginning. And then I have a better likelihood of getting to it. Okay. So that is all I have for today. Love you guys. I will see you again next month. Mwah. Keep doing what you're doing.